Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Longterm.
Happy Aloha Friday. Thanks so much for tuning in to Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yunji Denise, and we are live here on the digital platforms of the Honolulu Star-Advertiser. This morning, we're going to be spotlighting COVID-19. This, of course, as the new BA.5 variant continues to spread through our islands, but focusing in on a symptom of COVID that many in our community continue to deal with.
Yeah, we've talked a lot just in passing about long COVID, but we want to dive deep into this issue. What is long COVID? How are people here in the islands experiencing it? And if you are suffering from it, what can you do? So this morning, we've invited Dr. Dominic Chow, who is an expert in this field. He helps to run the post-COVID care clinic. And thank you so much for being here this morning, Dr. Chow.
Thank you so much.
So let's start with the basics. What is long COVID?
Sure. So it's the technical name is actually post-acute sequelae of SARS-CoV infection, and we like to call it long COVID for short, the layman's term. It is a condition in which individuals, after the initial COVID infection, they continue to persistently have symptoms. So many of our patients have shortness of breath, issues of fatigue, brain fog, as many of your listeners may know. So these constellation of symptoms, it could be a variety of sorts that have occurred during the acute COVID period or even after the acute COVID period, and it just continues to persist. And those are the individuals what we call long COVID because of the long progressive nature of these symptoms.
And what are the types of treatment that you folks are looking into, providing for those who are suffering through this?
Yeah, currently there is no guidelines or treatment for long COVID. My own thoughts is that there are multiple mechanisms for long COVID. So one size doesn't fit all. So many of our patients will have different symptoms ranging from brain fog. Some will not have brain fog. Some will have muscle aches. By far, the unifying theme among people with long COVID is the fatigue. Individuals are quite debilitated because of the symptoms that they have. And so because of that, it's hard to necessarily choose one treatment that could actually help all of those individuals. And so currently, the treatment of long COVID is really symptom-based. And so if you have, say, if individuals have shortness of breath, we would treat the shortness of breath. If the patient has chest pain, really directed therapy towards the chest pain. Brain fog is the same thing, where we'll try to do things that can actually help with reducing those symptoms that people have. So basically, it's a symptom-based treatment plan.
And typically, how long does long COVID last?
That's a great question. We don't know. The long COVID itself has only been in existence for 3 years, right? So at current, we've had in our own cohort of individuals in the post-COVID care clinic at Queens, I'll have to say that most of our patients, it resolves within the year, but we do have a segment of patients, about 15%, who unfortunately don't actually have an end date for them. They continue to have persistent in this fatigue and really are debilitated. And I'm hoping within the new year that things will get better for them, but they continue to struggle on a daily basis.
We've seen this virus evolve over time from when COVID first came out to what we're seeing now with the new variants. Does long COVID apply to all of these different variants, or have you seen it more maybe with the earlier on versions of the virus as opposed to what we're seeing now?
Yeah, so the original variant, the Delta variant itself, was probably in Alpha, was probably the acute phase where we saw a lot of hospitalizations. And so we saw a lot of individuals as post hospitalization. That's a big major risk factor for having long COVID. As time has come on, especially with the Omicron surge that we see now, um, we still see a lot of individuals with long COVID, but the symptoms are a little bit more milder. But yeah, it's a little different compared to the initial phases. But the percent or rates of long COVID is still, we still estimate about 10 to 15 to some people saying as high as 30% of all people who have been affected with COVID.
And that 10 to 30%, depending on which scale you're using, does severity of initial infection determine disease, determine long COVID? How do you know if you are more likely to get long COVID? Is there a patient
Yeah,
profile of any kind?
Yeah, there is currently no, the risk factors of having long COVID are really comorbidities. So people who have diabetes, high blood pressure, heart disease, obesity are at higher risk for long COVID. In terms of symptom based, it isn't clear if you're hospitalized. Clearly, that's a big factor of getting long COVID. But more recently, we've had patients who had very mild symptoms of COVID, and then 3, 4, 5 months later, they'll actually start to have long COVID symptoms, brain fog, fatigue, and it wasn't, it wouldn't have been apparent had, with the acute infection, their symptoms were quite mild again, and now they're having quite severe or significant symptoms, connected with their long COVID.
I'm wondering if there has been any similarities in the cases that you've seen, if there's any underlying indicator or a contributing factor that may have allowed the fact that you can maybe tell which individual, be it by age or even ethnicity. Is there any sort of similarities that you're seeing with any of these patients?
Yeah, that's a hard one. I don't think we know the answer to that question yet, but we are part of a larger NIH trial that's called Researching COVID to Enhance Recovery, the acronym being RECOVER. And being an investigator, part of RECOVER, we're trying to answer some of those questions, trying to figure out are variants which variants can actually be a higher risk for long COVID, also comorbidities, and also factors that are more tied into ethnicity, socioeconomics, in terms of social determinants of health. And so a lot of those parameters are being collected as part of this larger NIH trial that we will hopefully be able to kind of pinpoint what might be risk factors towards getting COVID and then possibly long COVID.
What about vaccination status? Is that any sort of protection against long COVID? Of course, we hope that you don't get COVID at all, and that's part of what the vaccine helps us to do. But we've heard a lot of people say, well, vaccinations, at the very least, could probably keep you out of the hospital. Can they also keep you from getting long COVID?
Yeah, there's a lot of different myths about the vaccination itself. So just to remind the viewers that vaccinations are here to protect you from getting hospitalized and also going to the ICU and really protecting people from dying. It's not there to actually reduce or stop you from possibly catching COVID. We know from the BA5 that it's quite contagious, and we're seeing quite a big of a surge currently in Hawaii. In terms of its effects, we have 15 trials that have shown that vaccinations do actually help with reducing or kind of stopping long COVID from occurring. So these 15 observational trials have been quite significant in our understanding of long COVID. There's a thought that perhaps people with long COVID may have ongoing viral replication, very low amounts in the body, and that by vaccinating, you would actually get rid of these viral sites or entities or replication in the body. I really do suggest that to the viewers that if you're not vaccinated, to get vaccinated, and that if you've caught COVID and you could actually, because of these 15 trials, vaccinations would actually reduce the risk of actually developing long COVID. And again, that has been seen in many of these trials. There was one trial that I know a lot of people have been pointing towards, the VA trial, that didn't see any improvements with getting, in terms of vaccinations and its risk for long COVID. But that is just one trial, and it was really centered on VA participants. And so that's a unique group of individuals. And so by far, the 15 larger trials all do support the use of vaccines for everyone in protecting from and reducing long COVID.
I wonder if you can go into a little more detail to explain some of these symptoms. I mean, you use terms like brain fog or even just severe, just fatigue. What specifically, I guess, does that look like? What are you seeing in terms of what these patients that you're treating are suffering through? I mean, what does that type of environment and life now living with long COVID look like for many of the patients that you're treating?
Yeah, unfortunately, again, there's a lot of myths and a lot of misinformation out in the community. Unfortunately, some of our patients have been isolated because a lot of their family and friends and even health professionals do not believe that they're having these symptoms. And so a lot of people on the outside do not believe of what long COVID is. And I want to assure and remind the viewers that long COVID is a real entity. It is a defined entity under the Medicaid, Medicare services. We've been studying it for for the past year or so. The mechanisms are quite different. There are some thoughts that it could be viral replication, viral persistence, and parts and bits and parts of the virus still residually in the body. There may be inflammation. All of these kind of result in higher inflammatory markers in the body, and that results in possibly these fatigue syndromes that people are having, and the brain fog, as well as chest pain and shortness of breath. And so our patients are suffering quite a bit. Majority of those our patients that we see at the long COVID have shortness of breath, chest discomfort, and brain fog. And it's quite debilitating. Most of those patients who, by the time they come see us, are not able to work. And because of that, they're not, able to do oftentimes a lot of their activities of daily living.
That sounds just terrible. What about access to care? How long does it take to be able to get to see an expert like yourself? What kind of resources, how long is your waiting list? If we're talking 10 to 30% of people who get COVID, and I know we all know plenty of people who've gotten COVID, that seems like a patient population that would outnumber the resources available.
Yeah, so for local resources, at the Queen Emma clinics and the Queen's Medical Center post-COVID care clinic, the waiting list is about 8 weeks. And I do know our colleagues at Hawaii Pacific Health, they have also a post-COVID care clinic. There are national resources that people can reach out to. There's a support group for long COVID, supported by the NIH and also CMS. So there are ways that individuals do not have to kind of suffer alone. They can actually access these services to try to get some care that they can, to actually try to recover. I would still say that majority of patients should seek the care of their primary care physician, because that's the first line. As I mentioned, 10 to 30% of all people who have been infected with acute COVID will develop long COVID. And so we're seeing, or we will see, a rather large epidemic of individuals with these debilitating conditions. And so Queens, HPH, we're not going to be able to handle such a large influx of patients. it will really need everyone's attention in healthcare. And so starting out with your primary care physician is probably the first good start.
When you're talking about this, it's is an issue that's not just confined to Hawaii or just to our country. It's something that everyone throughout the world is, in fact, facing. What conversations are you having with your national or worldwide colleagues on this? Are those types of discussions happening? Are other people seeing advancements or breakthroughs in other areas that may help those who are in Hawaii suffering through this?
Yeah, as part of the Recover trial, we connect with many of the national recognized leaders in long COVID, and besides that, we also, being part of the John A. Burns School of Medicine, we also are connected with many other investigators who are actually studying this similar issue in their communities all across the United States. I think as we get better at defining what the mechanisms are, we'll have a better treatment outlook. Currently, again, it's all symptoms based. I think for now, very similar to what we experienced with HIV, it is a major issue. Patients are unfortunately suffering, and the first wave of patients are having to kind of undergo some of these starts and fits and starts of actually getting appropriate care. I do believe within 1 or 2 years we will start to see better treatment plans available for people with long COVID. But at the current moment, I would advise viewers not to go it alone. Seek the attention of your primary care physician. Seek care if you're not getting the appropriate care or not getting enough answers. Reach out to individuals like myself and nationally as well as locally to try to get those answers. Because again, not to suffer alone. But unfortunately, again, the epidemic is pretty new within the past 3 years, and so the amount of efforts is quite large, but the amount of treatments at the current moment is quite limited.
I'm wondering if you are seeing the same rates of long COVID in your pediatric population. Are kids getting long COVID in that 10 to 30% range as well?
I'm not an expert. I mainly treat patients who are adults. I have treated teenagers, several, but I'm not an expert in pediatrics. There was once a thought that children have a much less risk of long COVID, but I think it would be better if we involve our friends at Kapiolani Medical Center in answering that question.
When you look as a physician and you're seeing what you see now, what concerns you about the future of COVID-19 as a whole? Yes, there have been big breakthroughs, obviously, with vaccinations, with treatment efforts for those that suffer. But in your capacity as a medical doctor here in our community and seeing what you're seeing now, especially with long COVID, how long do you think that we'll continue to see this? And do you think that long COVID and new patients suffering through long COVID is something that will continue for some time?
Yeah, I'm really saddened to see a group of our patients, about 10% of our patients, unfortunately having persistence of symptoms, and we've tried various treatments on our patients to try to get them recovered, and unfortunately, it seems that there doesn't seem to be silver lining currently for them. I think it's going to take a lot of effort, continued persistence, continued diligence in actually getting patients to do the physical therapy to get them back to their pre-COVID state. It's quite sad what our patients are kind of going through. Many of those individuals cannot work. They're now on disability. just to kind of show you a picture of the day that they go through. They'll wake up fatigued. They'll have had a poor sleep. They'll kind of struggle with rising because what happens is that COVID affects certain parts of the body, the nervous system and the heart, that causes them to have autonomic imbalance, meaning that the patients will have quite a lot of dizziness and fatigue on standing. And then throughout the day, clearly they could try to prepare foods and such, but it becomes a chore to even do minor activities, and then struggle through the rest of the day, having concentration issues, possibly getting into arguments with their family members because their family members will constantly say, hey, I kind of asked you to do certain things. They forget to do those things because their concentration is not very clear. They may have work issues, if they are still working part-time, and performance in their job. And then, checkbooks and executive functions become a problem. Then they may have some financial difficulties because they're not able to, proactively make, write checks as well as balance budgets and get food. And so my heart breaks for them in their daily struggles in trying to recover.
I mean, the picture that you're painting is so distressing. I'm interested to know, when going back to the vaccination question, there had been some talk early on that even if you get a vaccine post-COVID, that could help to do what you're talking about to sort of give you an immunity boost. Are you seeing that in some of these folks? Is that actually working, or is that something that's now been tossed aside?
It is. We don't have data, but we have seen anecdotally that about a quarter of our patients who actually get vaccinated when they see us in the post-COVID care clinic, meaning that they have had the acute SARS-CoV-2 infection. They have symptoms defined by long COVID. They come because of their symptoms. It's severe enough that they come see us, and when we see them, we convince them. Some of them will finally agree to getting vaccinated, and a quarter of all those individuals will actually get better. And I'm not sure if it's the vaccine that's really helped them or not, but I think that from what we've seen, it seems that it probably was the vaccine that helped them. And it's that same mechanism that we feel is likely the reason why they received the benefit. There is a underlying viral persistence in the body. People, if they do the nasal swab test, it's not that same levels. We know that from the Stanford studies that there is ongoing viral replication in the nasal pharyngeal areas, and it requires what we call deep seeding PCR testing to find this viral replication. And perhaps by vaccinating those individuals who have viral persistence, that they're finally able to get rid of the virus. And when they get rid of the virus, they will these symptoms that they're having will finally abate.
I want to bring in a question from a viewer who said, my son got COVID at 7 months. He's about 9 months and is still coughing. Just again, to answer a question that we had earlier, I mean, would this constitute as a form of long COVID? How do you categorize this? And is this something that you see as normal?
Yeah, so those symptoms would still be consistent with long COVID. Again, the definition is quite broad, but people who have not had these symptoms before, who can't get it explained for other reasons, if someone had asthma before, that may not be consistent with long COVID. But say someone who has not had asthma has caught COVID and then subsequently had cough during the acute phase that has spilled over beyond 4 months, that would be a defined case of long COVID. And so for the viewer who has had this, this is not uncommon. We believe that might be an issue in which certain cells in the body are affected. We know that mast cells are affected by COVID, and perhaps the activation of these cells cause them to be a little bit more activated, a little bit more hyper in secreting certain cytokines that will result in persistence of these cough. And I think that individual who gave the questions should follow up with his or her primary care physician, as they could actually address this by giving, inhaled steroids or antihistamines. Those could be helpful in these cases of chronic cough and wheezing.
I'm interested to know when we see in our community now, there is this feeling that people are kind of done with COVID. They don't not necessarily want to wear a mask. The DOE just changed its policy that masking will not be mandatory in schools anymore. And a lot of folks say, well, the infection's relatively mild, so I'm not too worried about it. What do you say to those folks, knowing what you know about the patients that you see?
Yeah, I know. Everyone is tired. I mean, I'm tired of COVID too, in terms of the effects. But unfortunately, the long-term effects are there. Long COVID is a large concern. I would advise patients to still do the social distancing. I know it's hard, but to protect other individuals from increasing the pool of individuals getting infected, getting yourself, protected against COVID and preventing long COVID from occurring. It's unfortunate. I know people are exhausted from the pandemic, but we shouldn't lose sight that these are serious health concerns, and that we can't take our eye off of this.
We are out of time, but wanted to let you just kind of have any final thoughts as we close out this morning. Your message for those who are watching this, who are maybe know someone suffering through long COVID, or just are generally watching to get more information. Your final thought here this morning.
Yeah, so I'm a HIV physician with many years of experience, and one of the things that we saw with the HIV epidemic, we initially saw that very similar to the COVID pandemic. We first saw that there was a lot of deaths as well as comorbidities, and then morbidity of our patients. And then we got good at it in terms of we got antivirals, and we got good at producing good effective therapies. I see that there's a lot of similarities with long COVID itself and COVID infections. I would suggest that patients, continue to be vigilant about making sure that they don't catch COVID, get vaccinated, see their clinicians if they do get COVID, and then certainly with long COVID. As a researcher also at the John Edwards School of Medicine and also at Queen's, I would have your viewers help us with trying to find some of these answers. We are part of a larger NIH Recover study, as I mentioned before. If individuals who have recent had COVID infections or not having any prior COVID infections, we would want you to help us try to get some of these answers. And these individuals can actually do their, if they want to participate in a national study, it is covid@hawaii.edu. And just by emailing that, you could help us try to answer some of these questions and hopefully develop better treatments for long COVID.
Wow, we learned so much today from you. Thank you so much, Dr. Dominic Chow with the Queen's Post-COVID Care Clinic. We really appreciate all the work you're doing and all of the information that you shared this morning. Thank you so much.
Thank you.
Aloha.
Wow, Ryan, that was really enlightening and pretty sobering to hear that 10 to 30% by his estimation of folks who experience COVID, no matter how severe the infection, it sounds like, can develop long COVID symptoms. That's what they're seeing. And if you missed any part of the interview, go back and listen, because when he outlines just what a day in the life of the patients that he is seeing are experiencing, it just sounds really, really tough.
Yeah, and it sounds like there is still a lot of uncertainty. You heard him mention at the end that call out for any individuals who may be interested in joining the study or being a part as they go through and navigate the symptoms and the effects of long COVID, looking for individuals' help. but also recognizing that there are a lot of things that they are still learning. When you look at the longevity of this entire virus, yes, people are tired of it. Many people have moved on. But through this is still a work in progress, if you will, for many in the medical community as they learn more and get more data and are able to do more research. They're able to learn more about the effects of long COVID, and also recognizing that there really isn't any treatment, that they're trying to treat each individual that suffers through this by case, depending on some of the things that they are suffering through individually.
Yeah, and he did call it an epidemic, that long COVID will be with us for some time to come. He said that about 10 to 15% of the patients that he sees have been suffering with this for a year or longer. They just don't seem to be recovering, and that has led to some debilitating life changes. You know, his best advice is to continue the social distancing, the masking, the messaging that we've been getting and giving throughout the pandemic, because you really don't want to catch this virus as you really don't want to catch long COVID. He also did mention that while they are seeing as many patients as they can, the wait time to get into his long post-COVID care clinic is about 2 months. And so there are certainly a lot of people suffering. Also, he talked about the stigma and the perception that people, that non-COVID might not be a real thing, the isolation from friends and family who just don't understand the mechanisms of this disease and perhaps don't really give it a lot of credibility. So it just sounds like the folks who are suffering through this are suffering through quite a bit. We really appreciate having him on, and we do hope to have him on again. On Monday, Ryan, we're heading over to Honolulu Hale to talk with the mayor.
Yeah, we're looking forward to catching up with Mayor Rick Blangiardi. There are a number, of course, things that are in front of the mayor with the budget, as well as some other changes that are happening. We want to get an update, of course, on what rail it looks like at this point in time. Always a lot of questions for the mayor. A full show of a series of shows next week that we're looking forward to having. We hope that you have a great weekend, and we'll see you right back here on Monday for another episode of Spotlight Hawaii. Aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.